1st, and it looks as though a lot of people are going to be losing their food stamps out there, their SNAP benefits. And it looks like a couple of federal courts have come in and said, no, they have to pay it. Some states have said, okay, we're going to go ahead and pay it out of state budgets. But I also heard, this is also a live Q&A. So what we're going to do is we're going to crowdsource as much information, help as we possibly can. If you're new to my channel, my name is Ed Weir. I ran the 3rd business Social Security office in the country. Before that, I worked for the Department of Welfare doing food stamps and Medicaid, and many decades ago, I was a sergeant in the Marine Corps. So, but I've also heard that some states are trying to fund food stamps, and the federal government has decided to turn off that entire system, the EBT system, so states can't even put money in there if they wanted to. So that's, wow, that's pretty nasty. But we're going to see what's going on here. But regardless of the fact, if they turn on the food benefits, the SNAP benefits today, tomorrow, whatever the case may be, there are still issues going forward. Billions are being cut back. You know, close to $1 trillion is being cut back from Medicaid. Billions are being cut back from food stamps. We've got the Affordable Care Act. People's prices for their premiums for the Affordable Care Act are going up 200–300%. Medicare is going to be cut by over $500 billion over the next few years. Social Security resources are being cut, people that help you out. So, but on the brighter side, the rich and corporations got trillions of dollars of tax cuts. So there's that. So, but the most vulnerable in America are paying for it. All right, so we've got a lot of questions, and we're going to go through systematically. So try to listen as long as you can, and I'm going to go through a whole bunch of different programs that might be able to help people out there. A lot of seniors receive food stamps, and they just might be without this month, next month, in the years coming forward. Or a lot of people on disability also receive food stamps. So let's go ahead and go down systematically, and all of our outstanding people on our regular, our community always helps out. So if you've got any questions, type in the live Q&A. If you're watching this on a recording later, I've got a couple of places you can ask questions. Okay, so this is my website, one of the websites, mygovexpert.com, and we're going to go through this systematically. So if you dependent on food stamps, and obviously you're getting close to your full retirement age, or getting close to retirement, you can file for retirement benefits at 62 years old, and you're saying, well, I don't want Social Security benefits at 62 years old because I want to wait. But if you're in dire need now because of situation, you can file for retirement benefits now, and then suspend those benefits or withdraw those benefits later. I talked about actually this, the retirement thing in a video I did, yesterday, day before yesterday, the details on that. So that's one option some people out there are using. Disability. So disability benefits, if there's so many people that are eligible for disability benefits that are not receiving it because they don't know the process and stuff. When you file for Social Security disability, you essentially file for 2 different programs. It's called SSI and SSDI. And the reason I'm making this difference is if you've got young people out there that are disabled and they're said, well, I can't file for Social Security disability because I don't have the 10 years required to receive Social Security. Doesn't matter in terms of disability benefits. When you're younger, if you become disabled, you don't necessarily need the full 10 years of paying into Social Security under what's called the SSDI program, Social Security Disability Insurance. But there's another program called SSI, and there's a lot of people eligible for this that are not getting it. SSI is not Social Security income. Everybody thinks it's SSI, Social Security income. No, it's called Supplemental Security Income. It is a welfare-based program. That means it's low income. You have to have low income, low resources. And you either have to be disabled or 65 and older. With SSI, for this year, the max you can get is $967. For 2026, they changed it. It's $994 for 2026. If you're a couple receive an SSI up to $14.91. So SSI is supplemental security income, low income, low resources, disabled, or 65 and older. And anytime you file for Social Security disability benefits, they always address both programs as what they call it inside. Title II and Title 16. Title II is the SSDI. Title 16 is SSI. Title 16, the Social Security Act. I don't want to bore you too much with it. The inside baseball. But those programs are available, SSDI and SSI if you're disabled. Okay, what else is out there? Again, we're going to go through the entire list here, and there's always a lot of people saying, yes, we know about the food banks. There are food banks in your particular area. I'm sure there are food banks. Hopefully there's food banks in your area. I don't think they're going to be able to hold up this month or in the coming years with all the cutbacks on everything. All right, what else we got out there that you might be eligible for? Remember, our community, what we do in this community is, you listen for yourself to make sure you're squared away, as we used to say in the Marine Corps. You're all set in terms of the benefits you're getting the right check at the right time, and you're taking advantage of all the programs that you paid for that are available for your particular situation. But our community always looks out for everybody else around them. So they take this information and talk to other people in their community and their relatives, friends, the waitress, the guy that works at the gas station says, hey, I know your daughter is struggling. Your daughter's, kind of sick and, disabled. Have you applied for SSI? Have you applied for SSDI? All this other stuff. So go out into your community and help as many people as you possibly can with this information. And if you have any particular questions, that's what you do. You come back here during the live Q&A, so make sure you subscribe, or you record a video question, and I'll show you how to do that later. I've got some video questions here. Okay, so if you are 60 years old, 60, you're eligible for survivor benefits. If you were ever married to anybody, and this is what a lot of people make mistakes on, they say you had to be married 10 years. No. For survivor benefits, no. If you were divorced, yes, 10 years. But if you were married to that person when they passed away, you only had to be married to that person for 9 months. There is actually exceptions. That's one of the problems with Social Security. Congress has built so many exceptions to the exceptions that it's over 20,000 pages of policy. And that's why so many people are losing benefits, because they don't know about them. The exception is if you had to be married to that person for 9 months, or if it's less than 9 months, that person passed away by accident or was in the military. So those are exceptions. So survivor benefits start at 60 years old, except for what's called, here's what another thing, probably hundreds of thousands of people out there that are eligible for these benefits that don't get them. It's called disabled widows benefits. But if you're between 50 and 59 and you are a disabled widower, Social Security calls it surviving spouse, then you're eligible for benefits on that person's record. So there's a lot of people out there, probably some in your community, someone you know, or someone you tell someone about that, and they know someone that knows someone, so was it 7 degrees of Kevin Bacon type situation? That's what we're looking for here. So if you know someone that was married to someone and they passed away, and they're between 50 and 59, they're disabled, they're sitting around there, well, I can't file for disability benefits because I never worked. I was a stay-at-home parent, mother or father or whatever the case may be, so I can't get disability benefits. Wrong. Number one, just might be able to get SSI. Don't have to be insured. Number two, you were married to someone and you might be able to get disabled widow benefits. So let's go out there and see. And then if we get people, for the new people here, we get people all the time that come into our live chat and go into the video questions after and say, yeah, I just found someone down the street that found some money. So we called up Social Security, or we called the Department of Welfare and Medicaid, and we got that person money, and say, or they're so happy. I got a free lunch out of it and stuff like that. So we love that. So, and we love when you tell us that. So please. Okay, family benefits. So family benefits encompasses a lot. So if you were married to someone for 10 years, again, if that person is still out there alive and kicking, you had to be married for a divorce type situation for 10 years. So spouses, if your spouse is currently receiving retirement benefits and you're 62 years old, you can receive benefits on that person's record. There's a calculation that has to be made first. Ex-spouses, divorced spouses. Again, we already talked about surviving spouses. Children, if you have a child and that one of the parents is receiving disability benefits or retirement benefits, that child is eligible for benefits on that person's record. Again, you can go into my website, mygovexpert.com. Sorry, it's not showing the top part. There's the top of it right there, my Social Security, mygovexpert.com. And you just go in there and let me pull this down a little bit, and you click on the Social Security part and it goes retirement, disability, survivor, SSI, Medicare, and then we'll get into living on Social Security alone and all the other information it has. It's all 100% free, so use it and share it. All right, so for family benefits, we're talking spouse benefits there. We're talking divorce spouse benefits, independently entitled divorce spouse benefits. A lot of people miss this one. This is people are sitting out there waiting for benefits from a divorced spouse, but they're saying, I can't file for benefits on a divorced spouse because they haven't started benefits yet. Incorrect. As long as they're 62 years old, you can file for benefits on their record. And I've got the Social Security reference down there because a lot of Social Security employees, unfortunately, the people at the front windows tell people the incorrect information all the time. So I had to put the Social Security reference right there. Child benefits. Here's the child benefits. Again, if you're under the age of 18, you can get benefits on a parent's record. And here's a question that a lot of people ask, what about grandchildren? Because there's a lot of people out there, grandparents thought they were done raising kids, but life is what happens while you're making other plans. You have to take care of a grandchild. Grandchildren can receive benefits from your record. If you're a grandparent receiving retirement benefits or disability benefits, that grandchild can receive benefits from your record if you adopt them, or if their parents are deceased or disabled. So let's get that word out there. So you have to adopt the child, or again, the parents are deceased or disabled. And so the child will get benefits up until the age of 18 years old or until they graduate high school. It used to be until you graduate college, but now it's until you graduate high school, or 19 and 2 months. And then if the child is disabled, there's a thing called Disabled Adult Child Benefits, DAC benefits. So if the child became disabled before the age of 22, then the child can continue to receive benefits for the rest of their life as long as they're disabled. Okay. All right. So, and then also got a section in there about SSI, Supplemental Security Income, and all the other how to apply and work and avoiding problems, the different state variations, and so all of the rest of it there. Okay. Let's get into Medicaid. So Medicaid is going to be cut back substantially as well, about $1 trillion. And, there's people passing in misinformation. Oh, we're only kicking illegals off of, food stamps or, Medicaid. And I'm here to tell you, people that believe that, they want to believe that. You can't tell them otherwise. But the reality is, if you're not in this country legally, you're not getting Social Security, retirement benefits, disability benefits, SSI, Medicaid, food stamps. Yeah, it's not happening. So unless, yes, people will say, well, when people go to an emergency room, yeah, well, they're not paying that person, they're paying the hospital. So the hospital doesn't take the hit of most of what the hospital, they take the hit on uninsured patients is American citizens going into a hospital and not being insured. So the government and their states kind of reimburse the hospitals for that uncompensated care. And a small percentage of those are people that go in there that are not in the country legally. That's the only way, but it's really reimbursing the hospitals other than necessarily. Anyway, so yeah, but people want to believe misinformation. You can't. It's kind of like a warm sweater that sometimes you got a sweater and it's got one little thread there that's loose, but if you pull that thread, the whole thing unravels. That's kind of the idea. They say they probably understand that, people that are not in this country legally don't get benefits, but they don't want to pull that string because, yeah, so that's just a situation we have to deal with. All right, but if Medicaid, and this is one of the reasons we built this our new website also, is what's going to happen in the future with close to $1 trillion being cut out of Medicaid, and bunch of money being cut out of food stamps, a bunch of money being cut out of Section 8 housing. There's going to be a 2-year limit on Section 8 vouchers for some people. It's going to get more and more difficult. So we needed a crowdsource. We needed a place for people to get together and help each other out. So that's exactly what we did. We started a brand new hub, a brand new discussion forum, area24help.org, where you can go in there. So please register. We didn't anticipate it to help immediately. Well, it can, but we just started it, and then this food stamp crisis happened. And so we need as many people in preparation for when the one big beautiful bill starts rolling downhill and all this stuff starts happening across the board. So please register. It's 100% free. We don't spam you with a bunch of garbage, but it's a discussion forum. So if you're in a particular area and you're having a problem with the local Social Security office, with a local food stamps office or Medicaid, you want to find out how to file an application, why you were denied, all that kind of stuff, this is a place where people can talk and help each other out. That's the most important thing. But the important thing is we need people there to help out. So please register. I'd appreciate it. So. All right. So in terms of Medicaid, that is a welfare-based program as well, means low income, low resources. Usually in most states, you apply for Medicaid and food stamps at the same place. So I'm sure people that applied for food stamps, they also took an application for Medicaid. They're supposed to address both programs. And someone in the questions before we even started today, someone said they received notice that they got some money put on their food stamp card, their SNAP card. It was only partial. Okay, here it is. Right. Last night I received a message that I would receive 25% of the $102 I received in benefits. Well, that amount on my SNAP card is $44. That's not 25% of $102. I'm grateful, but they are lying. Okay. Yeah. Has anybody else received partial in there? I've seen some places, again, that's mentioned that, again, they're still trying to work it through the courts, even though in September on the Department of Agriculture website, they said they can use that emergency fund, that $5 or $6 billion. They can use it during a government shutdown. But then they took that off the website, and then they said, oh, we can't use it because of yada, yada, yada. So that never seemed to stop this administration. And someone said, if we stop giving money to foreign countries, then we'll have money for himself. We did. So that old lie, that old chestnut is kind of thrown out the window now, right? They've been saying that for decades. Well, as long as if we stop giving money to foreign countries, then we can take care of American citizens. Well, we did. They shut off USAID and we stopped giving money to foreign countries. And guess what? They still cut Medicaid and food stamps and Section 8 housing and Medicare. So yeah, so that'll, and then they also, beyond that, they even found $40 billion to help out their buddies in Argentina so the guy could win the election and some guy that used to work at Goldman Sachs allegedly could recoup his investment. So yeah, so that whole thing is. All right, so Medicaid. Medicaid, same type thing in food stamps, the Affordable Care Act, the advanced premium tax credits that people are receiving on the Affordable Care Act, those are going to be going away substantially. So a lot of people are going to have a lot of difficulty there. So in terms of health insurance, you have the Affordable Care Act, you have Medicaid, Medicare. For Medicare, you get that at 65 years old, unless you're disabled. If you're disabled, SSDI. You cannot get Medicare from being on SSI. You have to be on SSDI. So once you're on SSDI for 24 months, then you're eligible for Medicare at the 25th month. And what a lot of people don't realize is people on Medicare can also receive Medicaid. So there's a lot of things out there that people say, well, I'm receiving this. Okay, fine. But you also know you can receive this. You know, one person can receive retirement benefits on their own records, benefits as a spouse or divorced spouse from somebody else's record, or they can be receiving disability benefits and benefits from another record. They can be receiving Medicare because of it, and also Medicaid. and then also get one of those Medicare Advantage dual eligible plans with the grocery cards and the over-the-counter cards, and also get the low-income subsidy, which is the extra help with prescription drugs and potentially food stamps. Well, if you're getting those, it depends how much you're getting. So yeah, there's 4 or 5 or 6 or 7, and then also possibly Section 8 housing. Section 8 housing under the One Big Beautiful Bill, what are the cuts? About 43% to HUD. So that's going to be difficult for a lot of people out there, is getting all right. So many times we saw carts full of junk food loaded up in the ream. All snap. Yeah. Again, people love junk food. So yeah, we're not going to judge people what they buy. And again, that's people, they don't want to help other people. So they look at anecdotal evidence to say, well, I knew a guy that knew a guy that knew a guy that, was getting benefits fraudulently or whatever the case may be. And so therefore, let's throw the whole thing out in the bathwater. So they don't take that same logic other places. So they say, well, I'm an old Marine Corps sergeant. So Department of Defense, if you want to look at fraud, waste, and abuse, you should start at the Department of Defense. They haven't passed an audit in over a decade. Well, I have to be correct here. There's one part of the military that did pass an audit. And I'll give you 3 guesses, and the first 2 I'm not going to count. Guess what? The Marine Corps actually passed their financial audit, but everybody else over the last decade or so didn't pass their financial audits. It's been estimated billions of billions of billions of billions. 10% of the Department of Defense budget is fraud, waste, and abuse. So when are we going to shut down the Marine Corps? When are we going to shut down the Air Force? When are we going to shut down the Army, the National Guard, the Space Force, or whatever they call it? Yeah, nobody's asking to do that. People speed on the highway. So we're going to shut down the highways? The billions, perhaps $trillions that the banking industry, Wall Street, ripped us off during the housing crisis, where they manipulated bonds and leveraging and all that kind of stuff. And we're going to shut down Wall Street and shut down Goldman Sachs and all those other companies. Yeah, so fraud, waste, and abuse happens, yes. But the money that goes to poor people, predominantly to poor people that are, struggling, that's the first thing we're like, okay, well, I saw a case of this, and therefore let's just throw everything out. They don't apply that to everything else. It's because they just, again, divisive and full of hate. I'm on Social Security. Am I eligible to get an EBT card? It's hard to paying bills, and I can't buy food. Absolutely. It depends on how much you're receiving from Social Security. But number one, Lily, I think I've seen you here before, so if you watched my videos, so hopefully in terms of Social Security, you checked out, you listened to my videos, and you asked questions, and you made sure your current check is correct. You're getting all the benefits you're eligible for from Social Security, divorce spouse benefits, surviving retirement, your retirement check is correct and everything like that. So hopefully we're all squared away there. But yeah, if you're having a hard time buying food, absolutely. That's what these agencies are there for, is to help you get your benefits. And that's the issue going forward, is bureaucratic disenrollment or bureaucratic barriers that are built into the One Big Beautiful Bill and have been built in for the past few decades. All of these hurdles to prevent you from getting the benefits you're eligible for and you need. And that's one of the major reasons we came up with our website, 24help.org, is when they start putting out these barriers and these roadblocks for people around you, your friends and family, to prevent them from getting their Medicaid or continuing to get their Medicaid or get their food stamps or get their Section 8 housing or get their Social Security disability or whatever the case may be. When they put up those roadblocks, those people come to us for help. And then they come to this channel. I'm going to be here pretty much every day for the next 10, 20 years, hopefully. And the 24help.org is to help, for help, 24/7. So to help you and for help, for people to help and for help. So, but in terms, file and ask them, say, what's the threshold in my particular state? Because each state is a little bit different. What is the threshold in your particular state for receiving benefits? And they will tell you, hopefully they will tell you, And then if you're denied for whatever reason and you're under that threshold, then you appeal. That's one of the big reasons people are struggling out there, is because they don't fight the system. They get a letter in the mail and they don't understand it. It's all in, bureaucratic English. And people don't understand it, and they think, well, I guess I'm not eligible. I'm not entitled. I can't get it. Okay, I guess that's it. I'll go have some cat food or whatever. No, fight it. If you think you're eligible, or if you don't know you're eligible, check. Come over here, go to 24help.org, ask someone else in the community, and someone else is out there is going to help you out. Again, we need massive amount of people to help each other out. So please, please, please. So it's going to take us a while to build up a community on that. We've got 600,000 subscribers to this channel. So if we get those 600,000 to start helping people, then I think, we'll be nice and set. So, but Lily, definitely, what else we got there? Food banks, obviously, 211 in your particular town. They've got resources that you can find. And if you have a Medicare Advantage plan, then some of those have OTC cards, grocery cards in them. Unfortunately, a lot of those are kind of disappearing. So, Retired Cat, what's up? Just being mad at the government won't solve the issues. Exactly. We all need to support and get out the blame diversion waters. Need more positivity and help in the world. Exactly. So, yeah, that's what politicians have been doing for thousands of years. Divide and conquer, divide and rule. So when they don't want you to look at them, the terrible things that they're doing, they start culture wars. And that's, we've fallen for it for thousands of years, not just us here in America here. It's, it's going back to Roman times. And Chinese history and 5,000 years. Yeah, that's what they've always done. So, I need to look into these senior food cards I've been seeing the last few days. Never heard of it before. Yeah, what they basically are, they're not scams. They are reality, but the way they advertise them are 100% scammy a lot of places where the way they advertise them. So what it basically is, it's gotten a little bit better since the CMS, Center for Medicare and Medicaid Services, restricted those famous Medicare Advantage plans with the football players and the Starship captains. You know which ones I'm talking about. But other people are still doing it. Here's what they do. They say, oh, I've got this, over-the-counter grocery card, and it's $500 a month, or it's $2,400 a year, or whatever the case may be, and click this button to see if you're eligible, and call us to see if you're eligible. And then you call them or click the button, and then they're never going to let you go. They're going to, call you continuously and harass you forever, and then sell your information to everybody else so they can harass you ever. That's why people get 20 or 30 or 40 calls from Medicare people, is because they did that. So, so you call them up and they say, okay, what's your zip code? And you give them your zip code, and there's a 99.9% chance you're not in one of those qualifying zip codes, because that particular card, they look for the best one in the country. And then they advertise it to the entire country, bait and switch. So there just might be one available in your area, and what they are tied to is Medicare Advantage plans. And the law has changed, the regulations have changed, that there was a program, it's called VBID, and that's the one that has provided the best grocery cards and over-the-counter cards. That program ends December 31st. And then there's another older program that's a little bit more difficult to get, and it's less money. Some people said they've already got contacted, and in their particular area, it's the same. Very, very few people said it actually increased a little bit. But overall, they're less, smaller benefits. But they are tied to Medicare Advantage plans. So they're 100% tied. Those grocery cards, those over-the-counter cards are tied to Medicare Advantage plans. And the ones with the higher cash limits are usually, depending on your area, tied to Medicare Advantage dual eligible plan. What's a dual eligible plan? That's a Medicare Advantage plan for people that have dual eligibility. Medicare, they have Medicare and Medicaid. So if you get if you have one of the higher levels of Medicaid, then you can get a dual eligible plan. So you have Medicare, Medicaid, dual eligible, and one of those food cards, over-the-counter cards. So yeah, so you can reach out to Chapter there. This is also the annual enrollment period. This is another way you can make sure you save money for 2026, is making sure you have the best plan available, Medicare Advantage plan. You have to do that by December 7th. Your new plan will start January 1st. So if you call, it doesn't matter who you call, but we partner with Chapter there. They support everything we're doing here. They're paying for, their sponsorship pays for our websites, mygovexpert.com, the 24help.org, which costs tons of money. But anyway, it's free for you, 100% free, thanks to people like Chapter Medicare. So, when you call anybody to review your plan, have your current plan so they can compare it, your providers, prescriptions, your pharmacy, your priorities, you need more dental, vision, hearing, whatever. Focus on the prices, how much is it going to be for a hospital, whatever, and then stay persistent throughout the year. That's why I recommend Chapter, is because they'll fight with you, for you, the rest of the year. So if you get a prior authorization or someone bill, or you need to find a doctor or something like that, they're there 365 days of the year. Well, not on Saturday and Sundays. Well, they're actually available on Saturdays. They're actually open every single day until December 7th. I think they might take off on Thanksgiving or so. But anyway, Jackie, what my husband passed, I was told I was not eligible for the death benefit from Social Security or any of his benefits. Never understood that. Okay, so you are eligible, but because it sounds as though you were married to the person for at least 9 months, you're at least 60 years old, so there's 2 hurdles. But the other one is in terms of the benefit amount. If you're currently receiving retirement benefits on your own record, and then his wasn't more, then that might be the issue. So, Jackie, let us know what they said. Are you currently receiving benefits? Were your benefits more? You should have, at least, if you were married to him and you lived together when he passed, at the very, very least, you should have received that embarrassingly low $255 lump sum death benefit. So, let me see. My U card wouldn't work for over-the-counter medicine at the pharmacy. Bella. Yeah, there's a U card. It's tied to a Medicare Advantage plan, one of the biggest companies out there. I try to avoid using those health insurance companies' name, but you know probably which one it is. Over-the-counter medicine, yeah, those cards are getting easier to use, but what you can buy with them sometimes is difficult, and where you could buy it. So I would reach out to that particular company, and if you're a client of Chapter Medicare, you can reach out to Chapter. They've got a great app that helps you, an OTC application that helps you maximize your over-the-counter, budget. But if you're a client of Chapter Medicare, give them a call and say, hey, what's going on here? How come this thing doesn't work? Or you call that particular company directly and find out. So maybe it didn't work at that particular pharmacy. Sometimes they do that. There is a Medicare or a health insurance company out there that also owns a pharmacy that you know of. And so when you get their cards, they want you to go to their pharmacies. So they make money on both ends. Is that, wow. My husband is deceased. I'm drawing survivor spouse benefits. How do I find out if he got all his credits? As much as he worked, I think his check should have been larger. Okay, his credits, yeah, he has all his necessary credits because you're receiving a check. But you mean whether his work history is correct. You can request his DQI or CQI. It's the summary earnings query. It's basically what he paid into Social Security his entire life. The DQI is a detailed one. You can request that, but the problem is, even if you see a mistake, so this is why it's important. This is why I tell everybody to check your earnings record your entire life to make sure Social Security has the correct numbers, because if they don't, then when you retire, you're going to receive an incorrect benefit. Or if you pass, then your surviving spouse just might receive the incorrect benefit. So it's important that you check your earnings record with Social Security on a regular basis and get it corrected if it's incorrect. The problem with a surviving spouse like Dee Dee here is even if you were able to get that and say, oh, look, in 1985, it shows 0. I know he was working in 1985. How are you going to prove it? How are you going to prove it? If it's in the suspense file, if you just say, hey, I noticed it was missing in 1985. He worked for the same place in 1984 and 1986, the year before, the year after. And if that's the case, they can fix it pretty easily, where they will just look and there's a giant suspense file where, by the way, undocumented immigrants pay into Social Security. They pay FICA taxes. People that work under false Social Security numbers, or the one that IRS, the temporary number that the IRS provides, they pay into Social Security, or I should say they donate to Social Security, and they'll never get that back. So it's, anyway, I've seen estimates of about $30–40 billion every year that they pay into Social Security that they'll never get back. So when people say, oh, I saw this, again, it's, yeah. People are receiving, undocumented immigrants are receiving food stamps. Well, number one, they're not. And number two, $30–40 billion every year is donated by undocumented immigrants. So, yeah. And people say, well, they don't work. And when, they're in front of Walmart or in front of Home Depot, they don't get it. They don't get paid. Yes, those, yes. But other people that work in farms and factories and stuff like that, where the owner of the business knows they're undocumented, but they kind of, they want the cheap labor. They kind of turn a blind eye and they pay taxes. So, yeah, so they donate a lot to your Social Security benefits every single year. So, Archie, so when you talk about ex-spouse benefits, you didn't mention ex-spouse under 62 with disabled child who became disabled prior to age 18. I need the exact rule in this or where to find it. Okay, yeah, so that's called the auxiliary child and care benefits. So if, yeah, I've talked about this a whole bunch of times, but it's basically auxiliary child and care benefits. If you have a child under the age of 16, or a child that became disabled before the age of 22, and the other spouse is essentially reducing their work under the $23,400 for this year to take care of that child in care, then that other spouse can receive benefits just like the child is receiving benefits. There's a family max involved. So it's called auxiliary child and care benefits. So definitely, and the, so yeah, if it's a disabled child prior to 18, then if the child is under 18 years old and receiving benefits just because they're under 18 years old, if they're over 16, the child will have to be determined to be disabled for the child and care benefit to start. So that's a little hiccup there in that particular situation. But if the child has already been determined to be a disabled child under Social Security rules, then under, before the age of 22, then the parent, the mother, let's say the mother will, or the father, whoever, can receive those benefits forever. Well, until they reach their full retirement age, and then those benefits just switch over to regular spouse benefits. So, or divorce spouse benefits. The OTC cards are also depend on your area by zip code on Advantage plans. Exactly. Yes, there are some in the country that are really, really good. It's, it's a competition type thing. The health insurance companies have used those as kind of, kind of bait to get people to sign up for their plans and say, hey, we've got this $100 or $200 food card, over-the-counter card, and so sign up with our plan. But you should always focus on the most important things first to make sure your doctor is covered, your prescriptions, you're saving all the money you can on your prescriptions, the important stuff. And then if you got two plans that you're choosing from that are exactly the same, and then one has $100 and one has $200, then obviously, should take the $200 one. So, Chapter got me hooked up with a plan with a $160 a month card, and which was okay. So another company was lowering that over the counter card to $106, and another company in your area had one for 160 bucks. So that's a beautiful thing. I like it. Take and Took, what's up? How we doing? Saw a video today that made it clear that for every meal a food pantry can provide, SNAP can provide 9 meals for the same dollars. It's great that churches and charities are stepping up, but not sustainable. Yeah, it's never been sustainable. You look back in U.S. history that, private, charity and stuff out there is great, but it's kind of piecemeal. The rich areas, they, where they spend their money on the museums and whatever. Anyway, yeah, so it's hit and miss. So that's why we decided many, many, many moons ago to make it more, efficient. It's not completely efficient, but it's a lot more efficient than we give it credit for. Years ago, the food stamp would ask your income and what assets you have. Your amount you got was based on that. Yeah, it's pretty much the same. In some states, I know like California for Medicaid, and they didn't have asset limits. They're adding asset limits for 2026. But you do not want to know how long I have been on food stamps. I know that. Okay. Yes, but a lot of people, I forget those stats are, most people are only on food stamps not forever. So people think that when you're on food stamps, everybody on food stamps is on food stamps forever. No, a majority of people that are on food stamps are only in the little bump of their life. And people, if you want a perfect example of that, when you watch the food bank lines, people in line for help at the food banks, and they told them to stay in their cars. And there's been videos out there of, oh yeah, I went to the local food bank, and you just see all these new cars and stuff, and oh my gosh, all these rich people that bought new cars and stuff are on food. And so people interpret reality the way they want to interpret reality. Another person in our community would look at that and say, wow, that guy's or that gal's life was going well. They had a good job. They were able to buy a car on credit, and so they were going good. And then life happens. Amazon is laying off people. Walmart, UPS, the federal government under Doge and Elon Musk has fired a lot of people. So a lot of people that were doing well, next day, next month, they ain't. And that's the reality. So that's the way we should really interpret that. But people they just don't want to help. So they make any possible reason to make themselves feel good for not having compassion for other people. So yeah, but they're not part of our community. So, but every now and then they pop up here. So first month of my payment type of situation, and you hopefully negotiated and say, hey, I owe this much. You agreed with the amount. Number one, Social Security sometimes gets the overpayment amount incorrect. So double check that to begin with. And then once you've negotiated that, figured that out, then you say, okay, but here's how much I can afford. Anytime you have an overpayment Social Security, you can do, it's an SSA 632. You can automatically do a 60-month, withholding over 60 months, even amounts every month for 60 months. But if you want to do longer than that, because you can't do 60 months, then you do an SSA 632. It's a request for waiver of overpayment. And in there, you have to provide your financial records. You have to say, okay, here's how much money I got coming in. Here's how much money I got going out. And after all that, I've got 10, 20, 30 bucks. So how much of that 10, 20, 30 bucks are you willing, but make sure, but it sounds like you did all that and they messed it up somehow. So you need to make sure, you reach out to them and say, hey, here's the deal. Or maybe sometimes it takes a month or two to hit correctly. If something else was going on, because when Doge took over, they immediately said, if you have an overpayment, we're withholding 100%. Before it was 10%. They said, we're going to hold back 100% of your Social Security check. And then people, our community and other people have said, yeah, no, people won't be able to buy food or rent for a month or two or a month. And then you're closing all these, they didn't close any offices they closed some regional offices, but then they cut staff to help you. So it's putting all these barriers. So You have to fight for it. I lost my train of thought there, but anyway. Local Ticket to Work office I contacted late last week has 1 out of 20 employees who knows the program. Hopefully they can get me into one of those pharmacy tech positions that trains high school. Yeah, so Ticket to Work, that's a great program as well. So if you're on Social Security Disability, SSI, and while you're in that Ticket to Work, they can't kind of suspend your benefits or anything like that for work. So it's a program that Social Security contracts with that helps you go back to work to try to see if you can work, education and stuff like that. And it's a free program. But unfortunately, yeah, I'm sure they're getting cut just like everybody else. And yeah, it's, people complain, oh, there's people on disability that can go back to work. Yeah, sure there are. Yes, there's fraud, waste, and abuse in every program. And there's people that are on borderline that just need a little bit extra help to go back to work. And that's what the Ticket to Work is for. And if we cut that, then yeah, it's like people need to go back to work, but we're not helping them. Yeah. So, Dr. Weir, legal immigrants also pay into Social Security and Medicare, but enter the country even if it takes many years. Yes, exactly. Yep. People that are in this country legally. Yeah. And Elon Musk and some other guy from Tesla went up and said, oh my gosh, millions of non-citizens are receiving Social Security cards and at full benefits. And it's like, yeah, he just said non-citizens, people that came into this country legally, like you, Elon Musk. Yeah, the irony was completely lost on him and his buddy there. So Richard, Kansas, I received no health care because I can't drive 400 miles at 4.89 a gallon to see an eye doctor in the state that will take Medicare and Medicaid. Yeah, that's going to be another issue going forward is, so this is the, the bureaucratic roadblocks that are going to be put up going forward here. It's like, oh no, we're only cutting off, health insurance, Medicaid for illegals. Okay, well, they don't receive that. So where's the $1 trillion going to come from? Oh, we're only going to be cutting back for those lazy people from 18 to 64 years old that can actually work. Well, the majority of those people do work, and work requirements, fine. Okay. It's been tried in a few states. It didn't work, but if you want to try it again, go for it. So if they go back to work, if everybody goes back to work, you're still going to have hundreds of billions of dollars cut from the Medicaid budget. And that's going to trickle down to everybody else. And how is it going to be trickled down? Is it going to be more difficult to get it, more barriers, less benefits, and as Richard Kansas points out, less options. So if you have Medicare, if you have Medicare and a Medicare supplement plan, like a Plan N or a Plan G or a Plan F, you can go anywhere you want, but it doesn't cover eye doctors. So anyway, so there's that. But everything else, no vision, dental, or hearing. But Medicaid does in some states it doesn't. But I think in other states, because they're going to get less money for Medicaid, they are going to be cutting back vision, dental, psychiatric help, anything that they can cut back, and cutting back networks and cutting back how much they pay those doctors. And doctors are going to say, no, I don't want to take Medicaid anymore. We've already got a lot of doctors and hospitals and clinics that said they don't want to take Medicaid. It's going to be more. So people are going to be, in a few years, there are going to be areas throughout the country. It's like, oh, I got Medicare and I got Medicaid. Awesome. So now I don't have to pay anything, but I can't, there's no doctors that take it. So, and the system is not broken. This is how it's being designed. I did a video the other day that says customer service of Social Security is perfect, 100% success. I'm going to make the same argument for Medicaid, food stamps, Section 8 housing. The programs are perfect, 100% success. But the problem is you ain't the customer. They're successful for the people that want to cut those programs to make it difficult for you to get those benefits that you're eligible for that you need. So you're not the customer anymore. You used to be, but you're not the target anymore. You're the people that get the tax cuts, and get those tax cuts has to be paid for, because we're not going to focus on the budget anymore or the deficit. It's going to come from the vulnerable. So this is the most ironical thing, the craziest thing about the big, beautiful bill. We've got trillions of dollars of money sitting around that we can give tax cuts to the super rich and corporations, but we can't afford Medicaid, food stamps, Section 8 housing. And we can't, so, okay, cut those programs and then put the money at the deficit so our kids don't have to pay for it. No, it's cut the money from these programs and give it to people that really don't need it. So I don't know. I don't know what kind of alternative reality we're living in here, but it's sad if you live in a low income area. They seem only have off-brand vegetables like asparagus and lima beans, never ever any meat. Come on, asparagus is awesome. I'm with you on lima beans though. Yeah, some areas out there are food deserts as well. Inner city places, they've got no, and that's why people, go get addicted to all these, super processed foods. It's because, growing up, that's perhaps the only thing they had in those areas. So, thank goodness for SNAP for those who need it. Retired cat, yes, 100%. Again, yes, there's people, fraud, waste, and abuse and everything. So if we're going to, so anybody that says fraud, waste, and abuse, we should throw the whole baby out with the bathwater. Again, I've showed this several times. There are groups of people. We are group A. We want to help 100 people. And yes, there's one person in there that probably doesn't deserve it, scamming the system. But we'll focus on that. But we want to make sure we help as many people as we possibly can. The other group of people, that hopefully none of those people are here today, want to burn the whole thing down to get that one person they don't like because they're different colors of skin or their accent or whatever the case may be. They want to get that person. So to get that one person that they really, really hate, and it's going to make their life so much easier if I got him. Yeah, they're going to burn the whole thing down. So yeah, that's not us here. Low Gamma Trader. I don't think you've been here before. So what's up? We need to get back to fraternity orgs such as the Moose Lodge, Elks Lodge, and organized labor unions. Yeah. My father was part of the Moose Lodge in Bradenton, Florida. So that's where I learned how to swim. Thank you, Bella. Okay. Thank you for your service. Antifa. Okay. Let's see here. Trial work period. If you cannot do it, you don't end up homeless. Yes, the trial work period. So this is on disability. I'm actually going to do a video. I did a video on the 2026 updates of spouse benefits. I did that, 3 or 4 days ago, and I talked about all spouse benefits, retirement benefits, spouse benefits, and disabled, all that. And then I did one on the 2026 updates for retirement. And then over the next few days, this week, I'll do a video on the 2026 updates for disability. And we'll talk about the trial work periods and all that stuff. So stick with me and make sure you subscribe and like and all that kind of good stuff. People who've worked at full-time at Walmart qualify for SNAP to feed their kids. Yeah, I talk about fraud, waste, and abuse. While the heir who was born into billions of dollars, talk about a welfare kid, born into it, didn't, they say, they were born on third base and thought they heard a triple. She was born on home base, and made the home run, I guess. $300 million yacht. What is it called? Chaos, which I guess anyway, I think that's the name of it. Yeah. And that 300 people, Reagan used to talk about the welfare Cadillac. That's the welfare $300 million yacht. That's because that money, came from other things, but part of that is all of the full-time employees that work at these places, McDonald's or Walmart, dollar store, whatever the case may be, that these companies pay these people such low wages that they can't even afford food and healthcare, that they have to go on food stamps and stuff. And then, that goes with the U.S. military as well. In the U.S. military, there's people receiving food stamps that are active duty in the military. So that's the question that we should ask. Why in the richest country in the history of the world is over 40 million people even having to get food stamps, right? Are these actually corporate subsidies, right? So the board of directors, the shareholders of those particular companies can make more money, so they pay their people less, as little as they possibly can, and they know they're on food stamps and all the other, it's... Country 10. Sorry, truthfully, for all on here, God said he will meet our needs according to the riches. Okay. Yep. Food stamps for 5 years, raising for lids, and got my degree. Yeah, food stamps for 5. Yeah, while you were doing something to better yourself and stuff. I personally don't have any issue with that. Let's see. Part B always going up. Yeah, I checked just before I started today. It doesn't look like the Part B Medicare Part B premium has been announced or anything else, deductibles or anything. So once it's announced, then I will get into it and get into all the details. All right, let's get into some video questions. Let's see what we have here.
Hi, Dr. Weir. I was wondering about Social Security and working. I have injured myself at work and I am on Social Security. Can I not claim workers' comp or workers' disability while I'm on Social Security? Thank you very much.
Okay, so yes, absolutely. That doesn't, if you're on Social Security, retirement, disability benefits, it doesn't stop you from collecting workers' comp, public disability benefits, or whatever the case may be, company short-term, long-term disability. No, you can go ahead and get that. Doesn't affect your retirement benefits. If you're on disability benefits, it does affect workers' comp, state, city, county, federal, public disability benefits, workers' comp, same thing. It affects your disability benefits. It kind of offsets a little bit, but you can still get both. It just one offsets the other one a little bit. But yeah, absolutely. Absolutely. If you fell at work or something like that, you injured at work, file for workers' comp. And maybe you're thinking also that because if you're under your full retirement age, the limit that you can make is $23,400, but that's earned income or net income from business. Workers' comp or anything like that doesn't count as earned income, so it doesn't affect the annual earnings limit.
Hi, my name is Margie. My husband died 7 years ago at age 73. He was drawing Social Security, and I was drawing Social Security at the time, but at age 71, when he died, I changed over to getting his Social Security. And you said we were supposed to get 100% of what he got. Well, at that time, he was drawing 2,100. But when I changed over to his Social Security, I only got 1,800 a month. Mine was 800 a month. Is that correct? The correct amount that I should be getting or should have gotten then? Um, I was making a lot less than just his check alone when they redid everything. So I still had the same bills, but I didn't have the money to pay them. And I was just wondering if I should have been getting more.
Okay, so yeah, the survivor benefits, the way it's calculated, throws a lot of people off, and unfortunately, it hurts a lot of people because they don't know how it actually works. So if yeah, the numbers you threw out there don't really add up. But here's how it works. If you're receiving $1,000 a month and your spouse is the higher earning spouse is receiving $2,000 a month, then both of you are receiving $3,000. And then if anything should happen to the higher earning spouse, you get survivor benefits. You will continue to get your $1,000, however much you're getting, plus the difference between the two. So your $1,000 and $2,000, there's $1,000 extra there. So they add that $1,000 to you, so you get essentially $2,000. So people say when, the spouse passes, you get their check, which is correct, but it's minus your own. So that's what a lot of people kind of mess up. And if you're your full retirement age at that time, you get that person's full check. And, again, minus your own offsets that. So you don't get both full checks. But if you're under your full retirement age, then it's reduced. Anytime you take money from Social Security early, it's reduced. So maybe that explains that difference there. But the 1800 and the 800, yeah, that just doesn't, unless you've got like Medicare being taken out, or that person filed for delayed retirement credits. And you don't get delayed retirement credits as a living spouse, you get it as a surviving spouse only.
I was married.
So long story short on that, it's difficult. So what I would do is I would call Social Security and just confirm the numbers and have them explain exactly, and that's a good way for them to also double check, make sure the numbers are correct, and they'll explain exactly in your particular situation. Oh, the 1800 and the 800, and the reason is because you filed, a month early or 2 months early, and he was receiving delayed retirement credits, and you're also getting Medicare taken out or something like that. So yeah, because the numbers, the way the numbers you provided just off the top of it doesn't make sense unless that's included in there, but I'm not sure. So just give them a call and then come on back here and let us know what happened.
To my first husband for 25 years and got divorced and then remarried and was told that I could not collect benefits from him. How do I go about checking that out?
Yeah, if you're receiving benefits from one spouse as a divorced spouse or current spouse or whatever the case may be, and then get remarried, your benefits stop from that previous spouse. Okay. If you're receiving surviving spouse benefits, they also stop unless you're 60 and older. So if you're 60 and older, you can continue to receive surviving benefits on an ex-spouse, okay, or a previous spouse. If here's what a lot of people miss is they were receiving benefits from a first spouse, they got remarried, the benefits from the first spouse stop, okay, but then they get divorced from the second spouse. So they think there's a lot of people out there. Let's as Nick Carr says, neighbor up. I like it. Yes, neighbor up. So if you get divorced from the second spouse, now you're eligible, entitled to go back on either one. So from the second one, the first one, or whatever, you had to meet the marriage requirements and the calculations have to be correct. But just because you got remarried doesn't preclude you forever from getting benefits from the first spouse. So a lot of people miss that and miss money.
Hello, Sarge. I've been disabled for 10 years or so with broken back, and I'm on SSDI, and my work record indicates 2517 per month, and I've been receiving that. I understand that I automatically get switched from SSDI to full Social Security disability at age 67, which will be in 2 years. I'm wondering if I can stay on Social Security disability for 67, 68, 69, and when I turn 70, can I then press the button and receive Social Security retirement with the enhanced 24% benefits? Thank you.
Okay. All right. So, yes and no. The way you explained it, a little bit different. Okay. So I think what you're looking for what's called voluntary delayed retirement credits. And here's one that a lot of people miss. I talked about this yesterday, but let's go over it again. We always got new viewers every day. So when you're on Social Security benefits, retirement benefits, disability benefits, doesn't matter, and you hit your full retirement age, you can suspend your benefits. It's called voluntary delayed retirement credits. I've got the Social Security reference in my YouTube description, so you can check it out. And if you're going to do that, definitely take that down to the Social Security Administration, because they're not going to know what you're talking about. And so you have to show them, because not many people know about it. Not many people use it. So it's basically, once you hit your full retirement age, you can suspend your benefits voluntarily, but you're not going to get benefits. Then, because you're suspending your benefits, you're getting that delayed retirement credits, and delayed retirement credits adds up 8% every year you wait after your full retirement age. So your full retirement age is 67, you restart your benefits at 70. So whatever your benefit amount was, you add 24% on there. plus whatever COLA that's going to happen over the next few years. But absolutely. But you said you continue your disability. Yeah, you can't get those benefits. You can switch to survivor benefits while you're waiting for your retirement benefits to increase based on voluntary delayed retirement credits. But yeah, you can't. And then if you have a spouse receiving benefits, a current spouse receiving benefits, then those benefits are suspended as well if you voluntarily suspend yours. But divorced spouses don't get suspended. What I say about 20,000 pages of Social Security policy, that, yeah, so many people are out there not getting what they need.
Social Security was cut to pay my premium because Medicaid had been paying it. I made $8,000 last year, but this year I barely worked at all. Should I go back to let them know that I'm not making as much as I made last year?
100%, 100%. So if they cut you off, not sure what state you are in, but $8,000 cut you off of Medicaid, that you might have other type of income or something. But anyway, Texas and Alabama and Georgia are like the worst for that. Anyway, but yeah, if situation changes on anything like that, if you're receiving SSI and they cut you off because of work and then you stop working or reduce your income, make sure you notify them. Medicaid, food stamps, Section 8 housing, all of that. Anytime your situation changed, go back there and reapply. Or sometimes what they do is they put you in suspense because of extra whatever. And then when you go back, you say, well, I've lost that extra, and they will restart it. But you might have to redo the application. And make sure you subscribe, or you make sure you join our website, 24help.org. We're not going to do a whole bunch of stuff right now. People are already out there talking to each other and stuff, but it's in preparation for all the craziness that's going to happen with the big, beautiful bill. All of the changes that are coming down the pike, people being cut off, having to run through all those hurdles, the 20 hours a week, volunteer work, how do you do it? Well, how do you prove it? They're not doing it. That's what that website is for. So, yeah. So in preparation, please just go ahead and get in there. And that way we've got a community that can help other people. So we can, as gentleman says, neighbor up.
Hi, I'm 66 years old and still working full time. I earn 34,000 plus. I also have a sideline Airbnb business. So I know I'm over 34,000 at the end of the year. So I know that my Social Security payment, if I file and request it, will be taxed. And I'm wondering, when I retire from school where I work, will the taxation on my Social Security payments cease as my overall income falls? That's my question.
Okay.
Thanks.
You're welcome. All right. So yeah, tax. Yeah, I don't do taxes, but I think what you're talking about is once you go over you're receiving early retirement benefits or spouse benefits or whatever, and you're going over the annual earnings limit. And then anything over the $23,400, then they hold back $1 for every $2 you go over. So I think that's what you're talking about. Yeah. So in the Airbnb, normally those don't count as income, but it really depends on how you do your taxes. If you've only got like one and you rent out a room in your house or something like that, it doesn't usually affect your Social Security. It doesn't count as your, a part of that annual income. Unless again, it really depends on how you file your taxes. If you do it as a business, you have a bunch of those and you're doing it as a business, and then that's net income from business. And then that net income from business is added to your regular earnings. And so that will apply to the 23,400. So yeah. So once, if you're going over the 23,400, if you're going over substantially, then you call Social Security and you tell them, hey, I'm going to make, $40, $50, $60, $70,000 next year. And then they will suspend your benefits for however many months. So if you go over $10,000, then they will hold back $5,000 worth of benefits. So, and then next year, if it turns out that, oh, you didn't, then you call them up and say, yeah, it turns out I quit my job or whatever, reduce my hours, and they will readjust it. So absolutely. All right, last one, and then we're going to call it a day.
I have a question. I received a letter from Social Security. My ex-husband passed recently, and he was collecting Social Security disability, and I'm receiving Social Security. We were married 19 years, divorced over 10, and my question is, I received a letter saying your benefit is such an amount as a widow. This is in addition to the benefit of my amount on my own earning record. It says you will receive blank amount around November 2nd. This is for October. And then it says in your next payment, you will receive the difference between the benefits already paid and those now due. And they're going to send it all on one check after that on my Social Security. So I'm wondering the amount that I'm receiving along with my October check, is that going to be the amount I will be receiving permanently? Or is that only a little bit extra? I don't understand this. I'm confused. I don't know.
Okay. Yeah, those letters are crazy. And what makes it even worse is when a Social Security employee does something to your record, and they do one thing, and it takes there's two applications, or it's a two-step process. The system, as soon as they push the button, then that thing is done, and then it sends out a letter. And then they go to do the second part of it, and they push the button, and it sends out another letter. And sometimes the second letter comes first, and it makes it way confusing. So yeah, it's unfortunate. But anyway, so this goes to proof. So she was receiving benefits on her own record, and also spouse benefits. And probably if she's her full retirement age, if she's receiving spouse benefits, divorce spouse benefits, whatever the case may be, and she's her full retirement age, they automatically switch you. It's called an auto convert. They automatically convert you from spouse benefits, divorce spouse benefits, to surviving spouse benefits. So people, contact us all the time and say, yeah, I was getting, $1,000, and now all of a sudden I'm getting $2,000. Yeah, because I hate to break the news to you, but it sounds like your ex-spouse that you lost contact with has passed away. And so it's automatically switched up. But if you're not your full retirement age, then you actually have to do an application to get that, because it's a reduced amount. So, and either case, yes, you will receive those benefits forever. As long as it sounds like you're past your 60th birthday. So if you get married or something like that, it doesn't matter. You're going to continue to receive surviving spouse benefits. You'll receive surviving spouse benefits forever and ever and ever. So, all right, that is it. We've got any other? Let me see if I can find some new people that I've never seen consider all that. Put into my info into chapter website and got a call back within a half hour. My phone identified them as chapter Medicare. Awesome. And she helped me immensely. Found better plan than I have ever even considered. Awesome. Good deal. Good deal. Let me see here. Isabella, if in California, if you will buy a little better health insurance, you would receive medical. If you can afford it. I always recommend Medicare supplement plans. So when you're getting Medicare, you have to cover the gaps of original Medicare. And there's a lot of gaps of original Medicare. Let me put up the chart here. There's 6 major gaps. And the big one is this 20% copay, co-insurance. So you get a Medicare. So that's why people get either a Medicare supplement plan or a Medicare Advantage plan. The reason I recommend Medicare supplement plans is there are no networks. Anybody that takes Medicare takes your plan, and there's no prior authorizations. But the problem is there's a monthly premium for those, and it doesn't cover dental, or it doesn't cover vision, dental, or hearing, and you have to get a separate Part D plan. So some people just can't afford it. Number one, they don't know about it, so they don't, get it, or they just can't afford it. So they get a Medicare Advantage plan. And the key about the Medicare Advantage plan is this last one here, persistence. Because of the prioritizations and the limited networks and stuff, you just have to stay up on your Medicare Advantage plan. A lot of people love their plans, but they work for it. I'm sure they work for it. Penelope. Oh, Penelope is awesome. What's up, Penelope? You listen to a bunch of crap on YouTube channels and then fancy yourself as some kind of expert yourself. Oh, this is someone else. I don't think this is, this is, are you talking? I think we're having problems with EM talking something. So yeah, Penelope is awesome. I don't think she's talking about me. Are you talking about me, Penelope? I don't think you are. But yeah, I was talking about there is a new website out of the Philippines that found that they could make money, I guess, on YouTube views talking about Social Security, and they found an AI character. So they made this AI character talk about Social Security, and it's all pretty much BS. So I wonder what percentage of food stamp recipients are party wise. Not that it matters, but would be interested to know. Yeah, it's easy. It's very, very large percentage goes to red states. So, but again, hopefully, man, we can get those judges Supreme Court to work with Donald Trump. Yep. Thank you all. Good luck to us this coming holiday season. Yes, exactly. And reach out to, all right, we'll call it a day there unless I see something else pop up. Oh, here's one. Is there a form to ask for recalculation of my COLA for 2025? No, their COLA is a COLA is a COLA. It's, if they recalculate it for you, they recalculate it for the entire country, and that's not happening. The SSA agent I talked to agreed that it was $3 or $4 short. Yeah, COLA, there might be something else there. Maybe what you're talking about is your the high 35 years, because COLA is whatever it is, 2.8%. So yeah, it's, yeah. The only thing to be recalculated is your AMI, your average index monthly earnings, based on your high 35 years of earnings. So I don't know how the agent said it looks like it might be $3 or $4 short. That doesn't make any sense whatsoever. And if they said it looks like $3 or $4 short, then I think you talk to a customer service representative. You need to talk to a Title II CS claim specialist. And if they say it's $3 or $4 short, then easy. They do an A101 internal speak here and they correct it. But yeah, again, it's got to be based on your earnings record, because that's how they determine how much benefit you. If your earnings record is correct, then you have to correct that. You have to provide tax returns or whatever the case may be that shows that you actually paid into whatever years, and then they correct that. And by correcting that, that automatically corrects your monthly benefit amount. So, but anything short of that, yeah, that's, call them again and actually talk to a Title II CS, or even better yet, a Title II TE, a technical expert. And then, yeah, let us know what they say. All right, that's it for tonight. Y'all take care. Have a